gender is about identity and about individuals and health. It's so important that we consider like different identities and different ways people see the world when in terms of health and how we approach health and health issues.
I think gender plays a role in health because I think it affects lots of different aspects of health. So like gender-based violence and how like women and men can be like treated differently and how that has like an effect on their health. Also with like mental health, whereas like men aren't really seen as like they're meant to be seen as like strong and not have like mental health issues. And I think so ideals of like masculinity can sort of in some ways be like a barrier to healthcare and healthcare professionals.
Gender plays a role in health in loads of ways. So firstly in kind of like, because it looks at the way that we behave, I think especially in mental health it can have a lot of impacts. So kind of this like expectation of what a person is supposed to be can then influence the way that we think and the way that we kind of, like it's like an internalized thing that we're meant to be like this, and if we're not like this it's bad. So like looking at kind of like masculinity and people trying to achieve that like masculine ideal, and then if they can't, they kind of turn inwards and blame themselves. I think that also kind of like manifests itself through like gender-based violence as well. So in terms of like inflicting violence on others, which is a health issue, a lot of that stems from these ideals as well. And then also in terms of like your help-seeking behaviour and your wider like your health behaviours. So like at a very like simple level, like do you smoke? People think that more men smoke than women. I think also like the way that gender is perceived like inflicts how health professionals view people, especially if people aren't like prescribing to a gender binary, then like they can face a lot of stigma.
I think gender underpins everything in global health, no matter kind of where you're sitting at, what you're passionate about, because as I said, it's a societal construct. So if you're interested in refugee health, there's a lot of differences between different genders and also very common from your cultural background. If you're an anthropologist, that's something that you're going to be incredibly interested in. So I think it's just one of those fundamental things that you kind of need to understand global